Good morning, Melissa. Welcome to the Healthcare Rule Breaker Studio. So we're just going to jump right in. We usually like to start with you just kind of just telling us a little bit about yourself, what you're into, what kind of like nursing trouble you're causing. So I'll leave it up to you. Just let us know a little bit about yourself and what you got going on.
Awesome. First of all, thank you so much for having me on the podcast. I really appreciate it. And I love that you ask about nursing trouble like that. Like you're my people, right? Like, so I am Melissa Mills. I've been registered nurse for 26 years. Started out at the bedside. But I quickly learned that it's very hard to affect change when you're working at the bedside, one patient, two patients, three patients at a time, right? So I started in this journey of leadership and really have a heart for leadership, for empowering other nurses. And so I went into leadership up to director of nursing roles in home care hospice. Just started feeling like there wasn't a lot of support even for leaders, right? Like
Yes.
even nursing leaders don't have a lot of support. We don't get training on that. So I took a big pivot back in 2018 and I've always been a word nerd, just love to write, love to do, any sort of like curriculum. And so really started leaning into healthcare writing and found curriculum writing, which I love. And so I've been doing that since 2018. But still, I actually even had a moment where I was like, I'm going to give up my nursing license. This is just not for me anymore. And then I found the Commission for Nurse Reimbursement about a year and a half ago. And really that has ignited a new passion around nursing and given me a voice and really started leaning me into advocacy, which I never, ever thought that I would be really leaning into advocacy and healthcare policy. But today I am the fractional executive director for the Commission for Nurse Reimbursement and really working on reforming or modernizing the economic model that nurses currently are under.
Oh my gosh, I just am so excited to dig into this a little bit. You're speaking my language when you talk about leaders having no support. That is why I get out of bed every single day to try to do that. Yeah. But one of the biggest things that just is always the challenge, as you know, which is what you're working on, is we're included in room and board.
Yeah.
In the fee-for-service model.
Right.
And it's really hard to articulate our value.
Yes.
And how do you quantify the quality of care that comes out? And right. when hospitals are like incentivized to keep their nursing staff as small as possible,
right?
When finances are tight, nursing is the first to go, which is really why patients come to the hospital to receive nursing care.
Absolutely.
But it blows my mind to even think about where to start because there's been all this work done by, Linda Aiken's done so much on ratios and ANA is in supportive ratios and AONL is not in supportive ratios. And I've worked in states where both have happened and I don't know that that's the answer.
Right.
Where do we start?
Yeah, absolutely. So I think the first thing that we have to do is we have to educate nurses on how we even got here, right? And educate the public. Like the public doesn't understand this either, right? And so if you go back into history, back in the 1920s, nurses, we worked independently and we were paid independently by patients. We cared for them in their homes, midwives, we were delivering babies, we were taking care of the sick, and we were doing that all on our own. And then the hospitals were deplorable. And so hospital administrators started looking at nursing and saying, we need help. We need to make the hospitals better. And so they brought nursing into the hospitals. And then we started to buy into this medical model. And there is a kind of a women's movement issue here that we had economic power, right? Nursing is one of the largest economic vehicles for power for women. And we had some economic power. And so the administrators at the time in the 1930s, when Social Security started coming about, they started looking at how do we put nurses into the hospital, and look to the hotel industry and housekeepers. And so that is where, because, you go to the hospital, you pay for your room, and then somebody comes and cleans it, right? And they come in and they make your bed every day and they take care of things and tidy up. That's what nursing was modeled after. And so we are looking at almost 100 years of this economic model. And if you think about it, 100 years, nothing in healthcare is the same. Nothing. But yet we are under the same model. And you hit it exactly right on the head. Like, how does this current economic model impact us today? Well, nursing, we're not a revenue center, we're a cost center. And so if a healthcare company or healthcare business, healthcare system is looking to cut costs, we are the largest cost, right? We are the largest cost. We're the largest workforce. We're the largest cost. And so the first thing they want to do is they cut the number of nurses, they increase our assignments, give us more nurses, do more with less mentality. And that's where we are today. And then we know that causes negative outcomes, negative patient outcomes. But because healthcare is a business, that's the current economic model.
Right. Oh.
So I want to circle back to something that I heard you say when you're just kind of giving us your background and your experience. So one, I heard you talking about how you had considered like even giving up your nursing license, and basically what I gather from what you've been saying is you really needed to find something that just aligned with your passion, that reignited your love for how you give back to patients and the healthcare system. So I'd like to just kind of talk a little bit about how do you, if someone was looking to, really like reignite their love for healthcare, because we've heard a lot about nursing burnout and people leaving the healthcare system. Like, how do you align that purpose? How do you find that? What was it for you that kind of gave you that sense of, oh my gosh, like these are my people, this is where I need to be?
And you hit it right on the head. It's finding those people, right? Finding those people that invest in you, that see something in you and say, hey, Melissa, you're really good at this. Like, you need to lean into this area of what you're good at, right? And it's also about aligning your passions, finding something that you're really passionate about. And sometimes it's things that we don't even realize we're passionate about, because like I said, for me, if somebody had told me 5-10 years ago, oh, you're really going to lean into advocacy and healthcare policy and reform and changing things, I would have been like, no, because a lot of times that feels very political, right? And so many of us kind of shy away. Look, it's right after the election. We kind of shy away from politics. We don't want to talk about that. But we have to understand that everything in healthcare starts with a law, a rule. There's something that is telling us how to do things. And so you just have to start really leaning into what sets your heart on fire and what goes, wait a minute, that's not right. That's not right. We need to change this. And I think that's when you really start to find those people that empower you.
Can I just say, you said like relighting that fire. What a great question, Alyssa, because this is something that I talk about all the time. People are asking, how do I get joy back into my work? And Melissa, you nailed it. And sometimes we aren't even aware of what that is. So I always ask people to say, reflect on your best days at work. And what was it about those days? And how can you be intentional to seek more of that in what you're doing every day? Because there are parts of any job that we're not going to love. But if you're spending most of your time in those areas that really fill you up and light you on fire. And something else you said, my son, whenever he was getting close to graduating high school, the school counselor said, as he's trying to figure out where am I going to go in my journey, he said, what makes you so mad that you just can't handle it? And I was like, oh my gosh, that's great advice, because I can't stand terrible leadership.
Yes.
So I get out of bed every day to try to help cultivate people, because I don't think people want to do a bad job. They just
No.
haven't been equipped, like you said.
Yeah.
I love that, finding your passion and joy for it, because so many people are, I mean, it's exhausting in healthcare right
It
now,
is.
but we can have the hope. So thank you for sharing that, because I think that will be meaningful to the listeners, that will take some time to reflect on, why do I actually do what I do every day?
Yeah. Yeah. And I think you're right. Like, it's finding that hope and figuring out like where you fit in the bigger picture, right? Like you said, none of us want to do a bad job. And even if you go into leadership and management and whatever you want to call it, right? Like you you go that in that direction because you want to help, you want to empower people, you want to help people, you want to make an impact on patient care. Yeah, you're not at the bedside, but you're still wanting that trickle down effect of who you are to leave that impression, right? That impression on the world and on the healthcare system. And you're right, nobody wants to do a bad job. We just have to make sure we're equipped with the right resources.
Absolutely.
Okay, so I got one more question off of something that you said. I'm sorry.
No,
I'm
I love it.
listening. Okay.
I love it.
So I agree. So in the wake of like politics and advocacy, and I think that's one thing, and I'm sorry, my hair is like in my face this morning. I think that's one thing that as nurses, we've always struggled with, right? Like the advocacy piece. We have no issue advocating for patients, but we do have constraints where it comes to advocating for ourselves and our profession, and
Yeah,
even negotiating, like pay rates, right? Like it's
absolutely.
almost virtually not possible to negotiate a salary unless you are, kind of moving up that executive chain. And then even then it's a little constrained. So let me get to my question. If you're talking to nurses and you're trying to help them understand like how they can learn about what things are happening in our profession, where would you lead them? Where do you send them?
Yeah, I think, first you have to educate yourself, right? You need to do some research, understand what's going on, whatever it is that, like you said, whatever it is that makes you angry, that's like, this isn't right. Why? Right? I think a lot of times and I was talking to somebody recently about, I always I didn't necessarily view myself as like an innovator but when I go back and I think about even early on in my career, I was always the nurse that said, but why? Why do we do this? Why are we doing this? This makes no sense. There's an easier way, right? And so I think it's okay to lean into being that like agitator in a positive way, right? Like you have to figure out how to be a good agitator, but it's okay to be the person that's constantly saying, but why? Why are we doing it this way? And if you can keep asking those questions, right? I think you have to ask why like 7 times to get to the root cause of something. So if you just keep asking why, but why, but why, but why, I know you're going to irritate people, but just keep digging, right? Because at some point you're going to figure out what that root cause is, and then that's your issue. And that's where you can start putting your energy.
Okay, Melissa, I feel like that was the golden nugget from you for today is so I agree. I think inquisitive nurses are always the innovators of the unit, right? Like they're always the ones that are willing to like find the pathway, but they're always the ones that are finding the workaround, right? And the workaround is really the solution. And so I do think that you're hitting the nail on the head right there with the conversation of maybe you don't see yourself as an innovator, but if you're this person, you're an innovator. Like, just because you may not align with that specific term, it doesn't mean that you're not that person for your organization or for your unit or wherever you are in the workplace, in the workforce of caring for nurses. So I love that. I love that because I am I think the why and the questioner, the person who's always questioning things has so much power, especially when it comes to supporting the nursing workforce.
Yeah.
I love what you said about the approach of it too. It's like we could annoy people with that, but when we're coming from a genuine place of curiosity and how to not lose that, because we normalize the things that we see and do. After you've been doing it so long, you kind of become desensitized and it seems normal.
Yeah.
But to never lose that ability to want to shake things up and make it better, because we get lost in not even recognizing that our workaround is the innovation, but we don't even recognize it anymore.
Yeah, absolutely. And it's so funny because so Rebecca Love and Sharon Pierce are the ones that started the commission. And Rebecca has a podcast with Marion Leary. And I was listening, it's called Love and Leary. And I was listening to this probably 6 months ago. And they were talking about how the nurses that did the workarounds are the innovators. And I think in my mind, I always thought that being an innovator meant that you had like a product that you developed, right? Like I've got this new way of, doing something with IVs or chest tubes or, like a product. And it hit me as I'm listening to that podcast that, wait a minute, innovation isn't just about developing a product or having, 5 patents on your wall. Like you can be an innovator just being a thought leader on something or being an advocate for something. Like that's still innovation. And I think a lot of times, I know back, like I've been a nurse for a long time, right? 26 years. A lot of times the workarounds were like, oh, no, don't do that. You're not allowed to do that. And so we have to recognize that when we as leaders do that and say no, we are crushing innovation. We are crushing somebody thinking outside of the box and really improving patient care and the healthcare delivery system.
Alyssa, I have to forgive me for interrupting you, but you just said another golden nugget. That's honestly, it's really hard to hear. And I have a hard time saying it because I love nurse leaders and get out of bed every day to try to help support them.
Yeah.
Because who else does? But we are the number one barrier to innovation. And a dear friend of mine, Dr. Dan Weberg, he does innovation.
Yeah.
And he says that the nurse manager is actually the number one barrier to innovation. And I don't think that people realize that they're doing it and how heavy that no is to crush people from even bringing things forward. But my gosh, isn't that why you're on the Healthcare Rule Breakers podcast? Because you're like, no.
That's right.
Okay, so I was actually just going to comment on when you were talking about the saying no to the innovation. I think it also, or saying no to the workaround, also begets that we're not asking them why the workaround exists. So we're really then hindering like what could be progression, right?
Right.
So it's really to our detriment and to our benefit if we can find the yes and figure out, build the partnership, build the communication to figure out how you got there.
Yeah.
So I think that takes us back to, really, if that's your purpose, if your purpose is like, oh, I found this process, and that gives you fire, not letting up on that. So I just wanted to to piggyback on that conversation. Okay, Melissa. So on the Healthcare Rule Breakers, we always have one question that we ask toward the end of our conversation. So I'd love for you to tell us, if you could break one rule in healthcare, what's that rule? What would that rule be?
I think there is, and this is an unspoken rule, right? There's this unspoken rule that nurses, we're not maybe equal, right? We are, the doctor comes in, and I was listening to something yesterday and somebody said, the doctor comes in and we're supposed to get up and give them our seat, right? So I think the one rule that I would break is just for nurses to use your voice and not to be afraid of speaking up for yourself and really advocating for yourself and for change within the healthcare system as much as we advocate for our patients, right? We do that every day. And I know sometimes it's easier to advocate for somebody else than it is ourselves, but we have to start using our voice. And, there's somewhere between 4 and 5 million nurses in the US, right? You look at statistics and there's, some gray area for sure as to how many of us there are. But imagine if we were all unified, even with one message, how powerful we would be. And so even if you are new or you're like, oh, I can't use my voice yet, I've only been a nurse for a year. No, use your voice. And that would be the rule that I would break.
You said something that gets me on my soapbox of the power of the voice, and something Alyssa's really passionate about and has done a ton of work around is that your presence. I'm going to not nail it, Alyssa, the way that you say it so eloquently, but how we use our voice in a positive light. Mm-hmm. And so the example that always comes to mind is when we shut down Amazon, sending playing cards to the senator that said we sit around playing cards all day.
Yes.
We really got fired up about that and did something. Can you imagine if we harnessed that?
Yeah.
Did something meaningful with it. Mm-hmm. And we were seen as equals in the healthcare system and not less than any role, but we all offer something very unique. I do a lot of sports analogies. And so, the coach is no more significant than the quarterback, than the kicker, Absolutely. Whatever it is, we all have a unique thing, and nurses see the whole picture.
Yeah.
And yet what I'm seeing out there in the world on social media, it's the negative light that's shining out for the public to see rather than all the amazing things that are happening. So I love that rule that you want to break.
So I think I really want to hone in on the fact that you highlighted it doesn't matter your experience level.
Right.
So I think we get very hung up in nursing about experience and how long you've been a nurse and what that brings to the table. But I agree with you is that it doesn't matter if you've been a nurse for a day, if you've been a nurse for a year, if you've been a nurse for 20 years, like your voice is your voice and you know what you know. And you need to bring that to the table and elevate that and be part of the entire profession's voice and not diminish your own just because you think, oh, I don't have the experience for this or that. Because I think we all do ourselves a disservice with the conversation around what experience has value in our industry. So I love that you called that out.
Yeah, that and credentials, right? We get into this this alphabet soup behind our names, right? And so we've got all of these letters, but you know what? Even if you're writing LPN after your name, there is nurse in that. If you're writing RN after your name, there's nurse in that. If you have a 2-year degree, a 4-year degree, a doctor, it doesn't matter. You have value and you have a voice. And like you said, you know what you know, right? And so you see all of these problems in healthcare, and that's enough. You don't have to have some fancy title to be a leader, to use your voice, to advocate for change.
You can influence no matter what role you're in, for sure. But now I'm feeling hopeful, and I'm feeling this heavy burden of how do I help leaders? Because as a leader, when those people keep coming in with their new ideas, it can be really overwhelming. And that's where those no's come from. So, man, I'm going to do some homework now. I feel inspired to say, okay, how can I help keep pouring into these leaders so it's a yes and, as you learn in improv, and not the no that shuts down the things that can actually change the world. But don't get me wrong, it's overwhelming when there's so many things coming at you. It's like, I can't even keep up with today. So I feel inspired to do something more to help on my end of expertise.
That's awesome.
Okay, Melissa, I want to thank you so much for joining us, and we are so happy to welcome you to the Rule Breakers Club. And we appreciate a fellow a nurse troublemaker. You can't get past it. I love him.
We give business cards. Like, I need a card.
I mean, I think we need club cards, right? We need to have that. The Rule Breakers Club card for nurses.
Amazing.
Or maybe we can put a discount program together.
Yeah.
There's someone's innovation. Someone can take that and turn it into something. Well, again, I do want to thank you so much for the gift of your time and your knowledge and everything that you shared with us today. If someone was wanting to talk to you, and they were wanting to, just reach Melissa about all things Melissa, where would they find you?
I am on LinkedIn. That's the only like social media platform that I'm on, but I'm there all the time. So Melissa Mills on LinkedIn. Yeah. And I love connecting with nurses and other healthcare professionals. So definitely find me, follow me, send me a message. Happy to connect.
All right. Well, thank you for your time.
Yes.
Thank you.